Hey guys, it's me, Sweet Jean. I am here at the hospital having an MRI done. My doctor ordered an MRI as an inpatient with 24-hour observation. Basically, what happened is she lowered my pain medication. There was just some miscommunication between me and her, and the amount of pills I was taking a day, which I take 4, 6 o'clock, 12 o'clock, 6 o'clock, and then 12 o'clock. And somehow, like I said, our communication wires got crossed, and she ordered me pain medication to take 3 times a day. So I've been taking less pain medication, so I've been feeling more of the pain in my back. So I called a couple of weeks ago and I was complaining about this sharp pain that I was getting between my shoulder blades that would shoot up towards the base of my neck or the base of my head. And so I called and I spoke to the triage nurse. She relayed that message to my doctor, and my doctor basically told her maybe I have a fracture, maybe I twisted myself, while I was asleep. It could be a number of things, but that if I was that worried about it, that I should go to the ER and see if they would do like a CT scan or to testing, but that she wasn't going to send orders. And so that kind of frustrated me, and I said, okay, so I went to the emergency room, and you just don't go into the emergency room asking for them to do tests that your doctor wants you to have done. You could just come in off the street and say, oh, my doctor said I need this, this, and this, and there's no orders. So how are they gonna take your word for it, So luckily, when I went to the emergency room a couple weeks back, when I was first complaining about that pain, they did like a chest x-ray and then they did a CT scan, and basically they said that everything looked stable. And so I figured that there's probably nothing that has happened to me. Like, I don't think I have a fracture. I don't think I have anything new. I think it's just same old pain that I always have. The only difference is that I'm taking a lower dose of pain medication, so I'm now feeling it. And I think my body is just used to taking the 4 a day, and it helps me. I still go to work part-time. I still get up and I still do things. I run errands. I go to family functions. I meet up with friends. Yes, I have pain, constant pain in my neck, my upper back, and I get these cramps under here, and I get these, I have pain every day. I have pain. Sorry, I'm switching hands. But the pain medication that I was on was helping me have a somewhat of a normal life, and I was able to function and do things and get things done. So when she lowered the medication, I was finding myself in bed most of the time, because that's the only way that I don't feel as much pain is when I'm laying back on my back and not moving like how I am now. But if I happen to move and turn to my right, or try to get on my right side, or turn or try to move to my left side, or if I try to sleep on my stomach, then I feel the pain, because I have, like I've said before, 2 12-inch rods, titanium rods in my neck, and I have 12 screws in my neck and upper back. I'm missing 3 vertebrae. My C7, T1, and T2 are no longer there because I had a cancerous mass that disintegrated those vertebrae. So I have chronic pain. I don't want to have pain. I don't want to live like this. I don't want to take pain medication for the rest of my life, but I have to take something to help me function and have somewhat of a normal life. Otherwise, like I have been in these last few weeks, suffering from pain, and I just have to deal with it. And I find myself, like I said, laying in bed most of the time, and the whole world is just carrying on like it does. Days come and days go, and I so want to get up and run errands and do things and participate, but it's depressing and frustrating, because I've asked her if she can go back to my normal medication, my normal dosage that I had been on for the past year and a half, that my body's used to, that my body needs. But she made me feel really bad. She made me feel like I was making it bigger than what it really was. She made me feel weak. She made me feel like I was lying. She gave off the impression like if she thinks that I'm lying to her, that I'm addicted to the medication, that I'm a drug seeker. And like I said, I don't understand why she just can't go back to what I've been on. I feel like telling her, like, I have stage 4 cancer. I'm a terminal patient. I've been on nonstop chemo for the past 2.5 years, and I haven't had a break. I can't have a break because the cancer will spread. I feel like telling her, I have two 12-inch titanium rods in my neck and my spine area. I have 12 screws. I'm missing 3 vertebrae, right? I'm going to have chronic pain for the rest of my life. And I wish that I didn't have this pain. I wish that I didn't have this life. I wish that this wasn't my normal. This is my normal life. Like the life that I had before, I'll never have. Sorry. I can never ever go back to how things were before having cancer, before having the surgery, the spinal surgery. And just, if you're new here and you're not really sure what I'm talking about, I have all those things. I have breast cancer, started in the breast, spread to my lymph nodes, spread to my chest, my neck, my liver, my right lung, and throughout my bones and in my spine. Stage 4 terminal. I'll be on nonstop chemo for the rest of my life. I'll never be in remission. And I can maintain somewhat of a new normal, because it is manageable with chemotherapy and pain medication. And so this is my new normal life. So anyhow, she wanted me to come in last week before Thanksgiving. She was gonna send the order, or she did send the orders in for to keep me for at least 24 hours observation. I asked her if I could come in after Thanksgiving.
Did somebody check your out?
Yes.
Oh, okay.
I don't have a full.
Oh.
I might have been someone else that called.
Okay.
Yeah.
I didn't see it. Okay, that's where I went.
Oh, thank you.
It's taken care of.
Can you close the door?
Yes.
Thank you. So that was one of the nurses. They are so sweet and so nice here. They always treat me very nice, and they're very sweet all the time. So anyhow, I lost my train of thought. Oh yeah, she wanted me to come in before Thanksgiving last week, and so she ordered a 24-hour observation, longer if need be, or if they find something. I asked her if I could come in after Thanksgiving because I wanted to spend Thanksgiving with my family. And she kind of was like, well, I thought you were in pain. Like, I told her I'm in pain because I'm not taking the pain medication how I was taking it before. I'm feeling more pain because my dosage has been lowered. I don't think anything new has happened to my back. I just think I'm feeling more of the pain because I'm not taking the dosage that my body's used to taking to function. And so she was like, well, if you're complaining of that much pain, then we need to take you to the emergency room. You need to be admitted. We're going to do an MRI to find out exactly why you're having this much pain. So anyhow, I was just frustrated with her, and she wanted me to go that day or that night or the following day, and I didn't go. I waited till today to come in, which is the weekend after Thanksgiving. And I hope that she's not mad at me or that she doesn't get after me, but I have an appointment with her on Wednesday for results, so I don't see what the difference is whether I had it on Thanksgiving or the day before Thanksgiving or if I had it after Thanksgiving. I think I was the last patient of the day. I think she was in a bad mood and she was kind of taking it out on me. I think that the holidays are tough for her because her husband did pass away last year, and so maybe she was just upset or depressed about that, but she didn't have to put it on me and make me feel bad. She made me feel bad to the point where I didn't want to go back. I literally was crying on the way home because she made me feel bad. And I was almost to the point to where I want to see another oncologist. Like, I don't want to see her anymore because this isn't the first time that she's done this, where she kind of like made me feel bad or made me feel like I'm making things bigger than what they really are, that I'm not being truthful. And so, I don't know. So I'm really, really thinking about getting another oncologist. But for sure, I do need to see. I'm being referred from this hospital. I spoke to the nurse and explained to her the whole thing. So she's going to set me up for a consultation with one of the doctors here. Or I don't know if it's a doctor or if it's like someone that helps you to set up appointments to see a pain management doctor. So he or she can take over my pain refills and manage my pain so that I don't have to ever ask her anymore because she just makes me feel bad all the time. And so anyhow, I'm here. I already had my MRI. I was actually in that tube like an hour, and I'm so glad that I'm not claustrophobic because it's tough being in that little tube for an hour, and then with all the banging and clicking and clacking, and it's loud too. You have to put earbuds, like these things, I don't know what they're called, but you put them in your ear to try to block out most of the noise. So I should be getting my results pretty soon. My doctor should be getting the results. I don't know if she's on call or if it's someone else, but hopefully tomorrow I get to go home. Like I said, it's a 24-hour observation. Unless they find something, then of course it'll be a longer stay, but I really hoping and praying that they don't find anything, that the reason for my pain is that my pain medication was lowered, so I'm feeling more pain. So anyhow, I will have to do a part 2 as far as the results, as far as if I decide to stay with my oncologist or to get a new oncologist, and finding a new pain management doctor. And they're all of those things are gonna be, someone's gonna help walk me through those steps so that if I do, the transition is a smooth transition, and then there's no delay in chemotherapy, because I do not want to stop the chemotherapy for any amount of time, because the chemotherapy is what's keeping me alive. It's keeping the cancer from growing. So I get scared if I have to stop it. Actually, when I had my hysterectomy 2 months ago, I had to be off of it for a little while before I could start my new one. But like I said, I don't like stopping it. It's weird because it's chemotherapy, and so it makes me sick, but I'd rather take it and not have the cancer spread than not take it because it makes me feel sick, if that makes sense. Anyhow, thank you so much for sticking around and listening to me vent. I know this has been a video that's about 16 minutes long, so it's pretty long. And so anyhow, I appreciate each and every one of you. Thank you so much for all of your support and your kind words in the comment section. And if you have any questions or concerns, you can always leave them in the comment section. If I missed anything, or if you're just curious about something, I'll answer those questions in the comment section. Please, if I don't answer you right away, don't think that I'm ignoring you or that I don't want to answer. It's just that my YouTube settings are, I think there's a glitch in mine because I have it set up to where it's supposed to notify me whenever there is a comment, but I don't get those notifications. So I literally have to go to my videos and go scrolling down to see if there's any comments, and if there are comments, then I can reply, but I don't get the notification that anybody has left a comment. So thank you so much again. Like I said, if you are not subscribed and you like to continue getting updates of my cancer and my cancer journey, click the subscribe button. And I also do other videos like true stories, things that happened to me in my past that I think are funny or strange or weird. I upload those. I do dreamscape videos where I explain or tell you the dreams that I had, which I haven't done in a while. It's just that I can't remember any of my dreams as of late. So anyhow, thank you so much for listening, guys. I will update you in the part 2, and I will see you later. Thanks. Bye.